Hello, everyone. I'm Laura Widener. I work at the Epilepsy Foundation. I lead their advocacy team. Thank you for joining today's webinar. We're here to talk about a very important topic that touches many in the epilepsy community, which is mental health. October 10th is World Mental Health Day, when globally we raise awareness about mental health issues and mobilize efforts in support of mental health. As some of you might know or have experienced yourself, people with epilepsy can experience emotional challenges, including depression and anxiety. These feelings can be present most of the time or appear just before, during, or after a seizure. Either way, these feelings can greatly impact a person's daily activities or overall quality of life. So therefore, the Epilepsy Foundation joins World Mental Health Day to shine a light on mental health challenges that people with epilepsy can face, what supports are out there to help people, and also what policy solutions Congress is looking at to improve access to mental health care for everyone in our country. Just a reminder before we get started, the Epilepsy Foundation does not provide medical advice. We ask that you please always talk to your own healthcare provider who knows your own unique needs the best. If you need help accessing a healthcare provider, the foundation can certainly help with that. We just ask that you call our helpline. So I have a great lineup of experts to contribute to the discussion today. I'm going to kind of ask a series of questions, and then at the end, we'll have time for Q&A from the audience. So first of all, I would like to introduce Michael Linsky, who is the Director of Congressional Affairs at the National Alliance on Mental Illness, or Nami. Michael is a seasoned government affairs and nonprofit professional, having previously worked as a lobbyist for the National Organization of Social Security Claimants Representatives, the American Academy of Child and Adolescent Psychiatry, and the National Association of Home Builders. Michael has also worked on Capitol Hill and on numerous political campaigns. Next, we have Michelle Cerna, who is the CEO of Bridle, an equine technology company that builds software for equine professionals. She was diagnosed with epilepsy at the age of 19 and has spent her time since then advocating for epilepsy and mental health awareness. Outside of her professional career and advocacy work, Michelle can be found managing a 150-acre equestrian facility in California and competing in the sport of rodeo, which sounds very fun. And Michelle is also one of the foundation's epilepsy advocacy champions, which is incredible. Finally, Kate Brocker is the Senior Director of Programs and Partnerships at the Epilepsy Foundation, which strives to promote well-being and the creation of safe environments for those living with epilepsy. Kate is a board-certified family nurse practitioner through the American Academy of Nurse Practitioners. She has experience as a healthcare practitioner and administrator in diverse clinical settings prior to joining the Epilepsy Foundation. So now we're going to get started. As I said, I have a series of questions that I'm going to walk through with our panelists just to kind of get the issue out there and talk through some things. And then at the end, we'll have time for Q&A. So please use the chat function where possible. Put your questions in the chat function, and we will certainly get to as many as we can within the hour. All right, so Kate, first I'm coming to you. I want to back up a little bit. Can you explain how mental health might come into the lives of people with epilepsy?
Sure. Thanks, Laura. Thanks for having me today, and thanks to everyone for joining this webinar on such an important topic. Because we know mental health is important for everyone, but especially for people with epilepsy, since we know that people with epilepsy have a higher incidence for psychiatric comorbidities. And most commonly, that's like, for example, like depression or anxiety. So when I say psychiatric comorbidities, that's just a fancy way for saying two conditions that are occurring at the same time. So you have epilepsy and depression. That would be a comorbidity. And so there are really three main ways that epilepsy can impact mental health. The first is just, depending on what part of your brain is impacted by seizures, that can also affect your mood and could lead to depression. Also, sometimes before seizures, people will experience changes in moods, and after seizures as well. So that can vary by person. Second is seizure medication. So some seizure medications can be mood stabilizing and actually help with your mood, but some others may worsen it. And so that's why it's so important whenever you're, taking a medication for seizures, that you should be advised of any possible changes in moods, or if you experience suicidal feelings or any other changes. And if your provider is not, forthright in offering that information, making sure that you're able to ask those questions about just how that might impact you. And then third, just living with the challenges of a chronic condition like epilepsy can be, difficult to someone's mental health. And this can be for a myriad of reasons, but just the, fear of discrimination, or how you might disclose your epilepsy to loved ones or school or work, the unpredictability of a condition like epilepsy, never knowing when a seizure could occur, financial stress, whether it's, just all the providers and specialists are paying for medications, those can all contribute to one's mental health. And I think it's just important, while, we're focusing and talking about epilepsy and mental health, but also just a lot of these challenges would apply to caregivers who are caregiving for someone who lives with epilepsy as well. So like I said, mental health is just so critical for all of us, but those are a few of the ways that mental health and epilepsy come together.
Great. And you might have touched on this already. I think you have actually, but if you want to add anything else, what are some of the specific mental health challenges that people with epilepsy experience?
Yeah, so we use the phrase a lot at the foundation that it's a common and it's complex problem, right? So mental health is common. We know it impacts everyone, but it is complex to, when I'm talking about it, just to note that everyone's epilepsy journey looks different, and same thing with mental health. But we do know that mood disorders such as major depression, anxiety, bipolar, and others occur more frequently in people with epilepsy than in the general population. And then also specifically, depending on what studies you look at, between 25 and 50% of people with epilepsy will be diagnosed with a psychiatric comorbidity. So that's, a larger number than the general population. And we're also aware, NIH, which is the National Institutes of Health, recently had a study on epilepsy and suicide, and it found that there was a higher risk of death from suicide in people with epilepsy, and that risk range was, depending on other factors, anywhere from 2.6 to 5 times higher than in the general population. So those are just a few of the specific challenges, along with some of the other ones I mentioned earlier.
Okay, thank you. So Michelle, before I have a question come your way, I just want to acknowledge, talking about any challenges, and particularly mental health challenges, can be difficult for any of us, but talking about them is what helps bring awareness and helps others experiencing similar things know that they're not alone. So first, I just really want to thank you for being here with us today to share some of your story and your experiences. And I guess with you, I'd just like to start, if you don't mind, telling us how epilepsy entered your life.
Yeah, so I was diagnosed later in life. I was 19 years old when I was diagnosed with epilepsy from a brain injury, which by my bio, you can probably guess, horses was involved in that. And so I was a sophomore in college when I first began having my seizures, and it kind of was, very much so. I had my first seizure, and then from there on out, I started having a lot of seizures, many seizures a day. So that was kind of, it just really kicked off, and it entered my life very quickly.
And how, through your journey since age 19, how have you noticed epilepsy and seizures? How have you noticed it impacting your mental and emotional health?
Definitely, in the beginning was very, very difficult. I've always been really transparent with the fact that when I was first diagnosed with epilepsy and we began working with medications and seeing doctors, it felt like there was multiple different factors impacting my mental health. One was that I was going on and off of medications, and it was really impacting my mood. But coupling that with the fact, especially when diagnosed with epilepsy later in life as an adult, I felt as though I was grieving the loss of the life that I thought I was going to have. And it was a massive uplifting. And obviously I had to leave school, and it impacted my family and my friends and my independence. And so that weighed on me very, very heavily. And of course, as somebody who had a head injury, there's possibilities that that head injury can impact your mood. And so I really struggled with severe depression and struggled a lot with anxiety, and being somebody who was very independent and went out in public, all of a sudden I wanted to continue having that life. But obviously I was continuing to have seizures in public. And I really, really dealt with a lot of thoughts of suicide, for the fact that I felt that if I was going to spend a life with epilepsy, I didn't really know if it was going to be much of a life at all. And so it was very, very hard hitting, especially in your adolescence.
Yeah, definitely. Thank you for sharing all that. So Kate, step one of any process seems to be acknowledging the challenge, which, can be hard in itself, hopefully followed by taking action. So, as a professional who's worked in the mental health space, what are some of the action steps you'd recommend someone with epilepsy take if they're feeling like their mental health is starting to waver?
Well, Michelle talked about it a little bit, but just talking about it first and foremost, I think we've come a long way in this arena, but we still have so much work to do. I don't think people hesitate to talk about their broken ankle. And so I don't think we should hesitate to talk about our mood or our feelings or our thoughts. I think our physical health and mental health go hand in hand. So just making sure that you talk about your epilepsy, your mood, and how it might be impacting your life. And making sure that you tell your healthcare team this, how you feel at every visit. Like, hopefully, best case scenario, they're asking about your mood, your feelings, all of that at every visit. But if they're not, tell them about it. And then, when you see your healthcare team, make sure that, you can follow their suggestions. If you start a new seizure medication, ask how it can impact your mood, what to look for, what to do if new symptoms arise. If you experience depression or mood changes, make sure to work with your healthcare team and make sure to, a lot of providers, yes, they can manage mental health concerns, but also ask for that referral for a mental health professional. And I think it's really important to talk about that if you have thoughts ever of suicide or you don't feel safe, there are always people that can help. Don't wait for your next visit. Talk to your team right away. We can put some resources in the chat. There are a lot of great, besides we have our 24/7 helpline at the foundation. I know Nami has lots of great resources. There's also a number, just 3 numbers that you can call so that you can make sure you can talk to someone right away or go to the ER. So I just think that's important to always bring up. But also just remembering that a lot of people with their mental health, they want to improve that all the other aspects of our health, we use the term holistic, looking at a person as a whole and realizing that all these different areas impact your mental health. So I would say, go back to the basics. If you want to help your mental health, are you sleeping enough at night? Recommendations for an adult is, between 7 and 9 hours, which is really hard to do for a lot of us. How's your diet? Are you able to eat some fruits and vegetables, drink water? Are you getting outside? Are you getting physically active? There are studies that show that 30 minutes of activity can be as effective as antidepressants. I like to talk about social relationships and how important those are. I think you don't need lots of them, but just a few really good quality people that you can call on and that you can talk to. All of those things are so important. So like I said, for your mental health, after you've, talked to your team, is then focus on all these different areas of your other areas of wellness in your life. And that will in turn also help improve your mental health as well.
Great, thanks. And I just, after all that you just said, obviously just the past few years come to my mind, how much more difficult, the pandemic and isolation, even more isolation, and everything has layered on top of, things people were already experiencing. So definitely, I think the mental health statistics certainly have gone up. We all see that on the news. So just ever important to pay close attention, as Kate was talking about. So Kate, what programs does the Epilepsy Foundation offer that could be of support to people?
We have several different ways that we try to support. First and foremost, you've heard us say it, our 24/7 helpline. They offer supportive listening. They help connect people with epilepsy, their families and caregivers, to information, resources, and services nationwide. So that should be, your first step if you're just figuring out, okay, what's going on around me, or I don't know where to start. Please don't hesitate to reach out. They are a wealth of information. You heard me mention social relationships. Excuse me. So we offer support groups across our country through our different offices. And so that's a really great way if you're like, I want to develop some social relationships, that you can check that off, and also just meet others that might be going through similar challenges, and you might find a lot of, ability to just connect and bond over that. So definitely check into our support groups. Also, different offices throughout the country offer evidence-based self-management programs. So several of them have specific focuses on mental health, but also just that overall comprehensive approach to improving one's wellness and self-management journey with epilepsy. So once again, if you're interested, if those are being offered near you, contact our 24/7 helpline. We'd be happy to put to connect you or let you know what resources are near you in your area. And then lastly, we also provide bereavement support. So we provide bereavement support for those who have experienced loss from SUDEP, and SUDEP stands for sudden unexpected death in epilepsy. So through our national office, we offer a virtual monthly support group, which has been a really helpful place for people to come and talk and hear from others. And then we also provide one-on-one grief care as well. So grief counseling. So once again, if you're interested in any of those programs and offerings, just reach out to our helpline and we'll get you to the right place.
Great, thank you. So Michelle, back to you. Just through your journey, could you share any steps that you've taken to improve your mental health? Do you have any advice for people who might be in similar situations?
Yeah, it's definitely been a lot of work. I'll preface with that, but I think, for myself, in the first 6 months when I was diagnosed, I kind of bottled it inside. I didn't feel like I wanted to be a burden on anyone around me. And kind of the first thing that ended up happening and taking that first step in, improving my mental health, that I feel very fortunate for, was that I did truly have an incredible team of neurologists. And I was very honest with that team of neurologists. I never felt like I wanted to hide anything from them. And so the first step that they took is that, they gave me a referral into the mental health program at their hospital. I was a patient at UC San Francisco. And I started cognitive behavioral therapy there to start to kind of work through some of the anxieties that I had and some of the issues that I had. And I kind of took that next step where I realized that one of the best ways to work through what was happening, and I'm very much so a product of my generation, is that I started talking about it online in a very raw and very transparent way, which is probably not for everybody. But I found that for myself, through sharing this story of what I was going through, I was starting to receive messages from friends and strangers and friends of friends who maybe, it wasn't epilepsy, but it was something else in their life. And they were like, they thanked me for my honesty. And in that, I found such a strength in myself in saying, by doing this, I can help others, right? I always say that in epilepsy, one of the best things that you can do is to find purpose in it. Because I always tell, we're kind of stuck with it, right? It stays with us. And so finding purpose in it. And the last thing was going to a support group. I really adamantly did not want to go to a support group for about the first year. And finally, my mother was like, you're going to go. You're going to go to this support group. And it really was probably the best thing that I did in that next step. And I didn't even talk at those meetings. I kind of just sat and listened and realized that all of these strangers around me who lived in my area were experiencing the same thing, who had experienced maybe even more loss than I, or experienced, what I considered a worse situation. And so through all of that, I just learned honesty and transparency and finding purpose was really all I could do. And I think the understanding that not every day is going to be easy. I feel that now my mental health is in a really good place. And I found, a lot of peace. But I also understand that some days are really, really hard for me. And I just have to kind of give myself grace and understand that if there is anything that I can say to somebody who's maybe in the beginning of their journey with epilepsy, it does get better. That's a promise and a certainty that I know, and sinking into something that you love. For me, it was horses. I fully threw myself into it, and I found through that I healed through a community.
That's great. Thank you again just for sharing all of that. And sure, you're connecting with a lot of people, on the webinar and who'll listen to the recording. It's really helpful. Again, just to feel like you're not alone. Like that's a huge, huge thing. And hopefully you're helping others feel that. So thank you. Okay, so we've talked about, mental health at the individual level, what people can go through and what can be done to help. But this is all part of a much bigger picture. There's people with epilepsy who face mental health challenges, but so many people in our country, face mental health challenges for various reasons. And Michael, is on the solution side. What can we do about it, and how can we, improve things in our country? But yeah, Michael, can you start by giving us just kind of that bigger picture, some overall statistics about mental health in the United States?
Well, sure, of course. And first and foremost, I'd like to thank you for holding this wonderful panel on such a crucial issue, and for including Nami, especially to Michelle. Thank you for sharing your story. That is so crucial. So the first thing I always like to tell folks is that mental health issues are real, common, and treatable. We've made so much progress in fighting the stigma around mental health issues in the last 30 years, but sadly, stigma is still an issue. Even today, you'll still hear folks say it's all in your head or just choose to be happy. But we all know that's not how it works. Mental health issues are real, and they are very common. In fact, 1 in 5 US adults will experience a mental illness each year. Additionally, 1 in 6 youth aged 6 to 17 will experience a mental illness each year. So let's just stop for a moment and think about those numbers. 20% of all adults and over 16% of youth will experience a mental illness each year. Often the diagnosis of a mental illness is complicated by co-occurring conditions, as Kate was telling us earlier. We know that millions of Americans have both a physical and mental health issue or substance use condition simultaneously. Unfortunately, this is not limited to just the United States. The World Health Organization, or WHO, listed just depression, not all mental health issues, but just depression as the leading cause of illness and disability worldwide. So we know that mental illnesses are real and common here in the United States and around the world. But here at Nami, we're all about hope. So here's the really good news. Mental illnesses are also treatable. Mental illness is no different from any other disease. The sooner you get treatment, the better the outcomes. But one of the biggest challenges that we face here is that the average delay between the onset of mental illness symptoms and treatments is 11 years. On average, if someone starts to experience the symptoms of a mental illness at the age of 23, they will not get treatment until they are 34. If we were talking about a physical health ailment, we would never accept this. Could you imagine going around for 11 years with a broken leg without seeking treatment? Of course not. But unfortunately, this is all too common when it comes to mental health issues. So I think my big takeaway here is if you are one of your loved ones or one of the 20% of Americans experiencing a mental illness each year, know you're not alone. And know that there is help for you out there. And you do not need to be walking around on that broken leg for 11 years before you go and get help.
Great, thank you. Yeah, for laying that kind of high level picture. And yeah, those statistics are staggering and astounding. So definitely very, very common. The Epilepsy Foundation is a proud partner organization, Michael, of the organization you work for, Nami, in so many areas, including advocacy. But for people who aren't familiar with Nami, can you share what Nami's mission is?
Certainly. And we're so grateful to have the Epilepsy Foundation as one of our partners. Thank you guys so much. It's only because of friends like you guys that NAMI is able to do so much of its work. So NAMI was founded in 1979 by two mothers who were trying to get help for their family members who were suffering with mental illness. NAMI essentially started off as two mothers around a kitchen table fighting for their families. It has since blossomed into a national organization with over 600 affiliates all across the country. Our mission at NAMI is simple. We want to provide advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can build better lives. We do this by essentially embracing 5 core values. Those values are hope, which you heard me talking about earlier. We believe in the possibility of recovery, wellness, and the potential in all of us. Inclusion is one of those others. We embrace diverse backgrounds, cultures, and perspectives. And of course, empowerment. We want to promote confidence, self-efficacy, and service to mission. And compassion. We practice respect, kindness, and empathy, and fairness in everything that we do. We fight for equity and justice. As I mentioned, we have 600 affiliates and presence all across the country. On a personal level, if you or someone you love is struggling, know that you're not alone, and NAMI's here to help. You can always find a local NAMI and connect with support groups or education programs in your community. We just heard Michelle talk about how important that is. So that's why it's so important that we have wonderful partners such as you folks that have allowed NAMI to become the nation's largest grassroots mental health organization, and it helps allow us to advocate for all those who need our help.
Great, thanks. And perfect segue, advocacy. I was going to go into, what your specific role at NAMI is, which is in congressional affairs, advocating for policy solutions that will help those people living with mental health challenges. And this is kind of the world I sit in, so I'm a little aware, but you're definitely, much deeper on the mental health issues and policy issues. But from my vantage point, there seems to be a good amount of traction recently in Congress on mental health related policy. Unfortunately, some of that, is coming on the heels of tragedies that, have shown a light on the status of mental health in our country. But again, turning problems into solutions. Could you share at a high level some of the bills and solutions that Congress has been looking at?
Yeah, and you're absolutely right, Laura. This really is an exciting time. I've been working on mental health issues now for over a decade, and I've never experienced a moment like this where there's so much attention being paid to mental health by policymakers in both Congress and the administration. Prior to President Biden's State of the Union address this year, the administration released its Unity Agenda on mental health and substance use. NAMI was thrilled to see this focus on mental and behavioral health from the White House, and we were uplifted by the light that the president shined on this issue during the State of the Union address. He spent about 4 minutes talking about mental health and substance use issues at the State of the Union, something that I have never seen, and I've been doing this for a little while now. We're also seeing Congress focused on mental health issues as we've never have before. Multiple committees in both the House and the Senate right now are working on packages of mental health legislation to tackle everything from issues surrounding the enforcement of mental health parity to extending telehealth options past the COVID-19 public health emergency, to better integrating primary care and mental health, to working to get more resources into early intervention efforts, especially in our nation's schools, and addressing the dire lack of workforce that has plagued the mental health community now for decades. Please make no mistake, there's still a great deal of work to be done, but we are seeing a sincere desire from both the executive and legislative branches to try to tackle some of the mental health challenges that we're currently facing. And we may be starting to see some slow progress in one crucial area that often doesn't really get enough attention from policymakers, and that is the area of racial and ethnic disparities in mental health. Back in 2001, the Surgeon General issued a report about mental health disparities affecting racial and ethnic minorities. The report found that people of color had less access to mental health services, were less likely to receive those services when needed and often received poor quality of care and were underrepresented in mental health research. Sadly, we're now 21 years later down the road, and these disparities are still very much present in our health system. But there is a little bit of light here at the tunnel. There's a few pieces of legislation out there right now, including a bill from Bonnie Watson-Coleman, Pursuing Equity in Mental Health Act, that's attempting to address this issue. It's one of the many bills that Nami is a proud supporter of and is engaging our allies on Capitol Hill in an effort to advance this legislation.
Great, thank you. So you listed a lot of efforts, which is great that there's, again, so much traction these days in Congress. What's the status of them? Like, have any passed? Are they still in the House and Senate, haven't been voted on? Could you go through that?
Sure. So it's a little bit of both. As we're coming to the end of this Congress, the 117th Congress, there really has been some significant legislative victories this year. You referenced it earlier, Laura. Earlier this year, Congress passed and the president signed into law the Bipartisan Safer Communities Act. This legislation really made significant investments across the board in mental health programs, especially for our nation's schools, about $1 billion in mental health resources for our nation's schools. And it really invested in certified community behavioral health clinics. These investments will go to help additional mental health resources getting into those underserved communities that we were talking about before. There were also really strong investments made by Congress in the fiscal year 2022 budget for mental health programs. And preliminary numbers, just preliminary numbers for the fiscal 23 budget also looks really promising. I would be remiss, I know we talked about it a little bit earlier and it was referenced, but I'd be remiss if I didn't mention that earlier this summer, the new 3-digit Lifeline number came online across the nation, 988. What this is doing is it is replacing the previous 12-digit number for anyone who is in a mental health, substance abuse, or suicide crisis. So now, folks, all across the country, no matter where you are, all you have to do is dial 988, and you can be connected to a trained mental health crisis counselor. And you will be automatically put in. There's also texting options too for folks who would prefer to text with a trained mental health crisis counselor. So like I said, there have been significant achievements in this Congress. Even though we're coming to the end of the year, we're not quite ready to throw in the towel yet. Multiple congressional committees right now are looking to do an end of the year packages, potentially on mental health issues. While it's currently unclear if Congress will be able to get this done before the end of the 117th Congress, Nami is working hard to push this legislation forward this year. I don't have a crystal ball to be able to tell you if this will be able to get across the finish line this year or not, but I do hope to be able to report back to you guys in a few more months that we were able to get a couple of bipartisan packages through Congress here in the lame duck period.
That's great. Yeah, and I just, some of you on the webinar might be like pretty familiar with, how Congress works and legislates. It's really evolved, I would say, even in my career. But, I just want a quick add on to what Michael was sharing. Sometimes Congress legislates new policies through either kind of like a single bill that moves through, or like sometimes there are these big legislative packages that have a lot of things in them, including mental health reforms. So that's kind of one way Congress legislates, again, through like just kind of standard policy change bills. And then there's also the federal budget, which is, an annual thing that Congress has to pass every year, obviously, in order to keep the federal government and all of its programs and services running. We literally just passed, Congress should by October 1, that's the start of the new fiscal year, should pass the budget for the upcoming fiscal year, which should be fiscal year 2023. They haven't completed all the work on the budget, so you might have seen that in the news. Instead, they passed what's called a continuing resolution that will go through mid-December, keep the government operating at current funding levels But as Michael referenced, there's the possibility that, additional funding could be channeled towards mental health programs and services in the annual budget as well. So that's an exciting opportunity that's forthcoming, as well as a lot of funding priorities, that'll even more directly help people with epilepsy. So that's something to watch out for. And all these efforts in Congress, on mental health, Michael, I think everyone knows, things are a little divisive these days. Are they bipartisan? Because obviously that, helps a lot when you're trying to get bills through Congress.
Most definitely. And you are absolutely right. There's really few things these days that are bipartisan. And this might be what we're most excited about. I've been working on mental health issues for about a decade now, and in politics for much longer than that. I can honestly say I have not seen Congress come together over an issue like it has on mental health in decades. It's just come together on this in a real bipartisan manner. I don't think it's a stretch to say that mental health has really become the bipartisan issue of our time right now. The mental health bills that Congress has passed this year have largely been bipartisan bills, have been sponsored by both Republicans and Democrats. I can also tell you the end of the year packages that I referenced earlier. And as Laura was explaining, these big packages of bills that come together at the end of the year, the committees of jurisdiction, Congress is divided up into committees that handle various issues. And there's a couple of different committees that have different pieces of mental health. They are all coming together in a bipartisan manner to take a look at these bills. So it is really one of the most exciting developments on the policy side of this field, is that this issue has really brought both Democrats and Republicans together in a bipartisan manner.
That's great. Always good to hear that. So any of the mental health bills or packages that are still before Congress, any advice if people want to get involved, how do they do that? Do you have any advice for them?
Most definitely. And thank you for this question. It's so greatly appreciated. Like I was talking about, those committees of jurisdiction are looking at those end of the year packages for after election day, or what we call the lame duck period of Congress. With that said, while the committees are making a truly good faith effort to get this completed, the lame duck session of Congress is always a really hectic time, and Congress never gets everything done that they want to get done during this period of time. So to get these packages across the finish line, to get this legislation across the finish line, we're going to need the help of all of our allies. So you guys will have to forgive me here. This is the portion where I'm going to make a shameless plug here for Nami. You can always find out the latest developments in the mental health field and what Nami is working on and advocating for by going to our website, nami.org, and clicking on our advocacy tab right there on the main page. From there, you'll see an array of actions that you can take and ways to get involved, including joining our Vote for Mental Health campaign. When you take our pledge to vote for mental health at Vote for Mental Health, you'll receive resources about voting in your state and steps you can take to understand where candidates stand on issues that you care about. And of course, you can also get involved with one of our local Nami chapters. With over 600 chapters across the country, there is sure to be one near you.
Great, thanks. We don't mind shameless plugs.
Oh, well, right.
Again, it's such respected organizations like Nami. And I'm going to throw a surprise to our panelists, which I don't know if they'll be mad at me for later. But Michelle, you're an advocate. You're one of the foundation's champions, which if people on the webinar don't know, we have an adult program where we train people how to be advocates. We give them monthly trainings, as well as monthly advocacy activities that are federally focused. So Michelle's a pro at this, and whether it's on mental health or other legislation you've talked to members of Congress about and their staff. Do you have any? Could you just share a little bit about your experience as an advocate, and what are meetings like for anyone who's never done it? It might be a little intimidating.
I've had quite the positive experience. Actually, I feel often as though it isn't necessarily that people don't want to advocate for epilepsy, especially at a congressional level. oftentimes is that they don't know about individuals' struggles with epilepsies. I know that traditionally epilepsy has always been something that people have been a bit more quiet about. And in recent years, I feel as though people living with epilepsy have done a phenomenal job of really standing up and speaking up for themselves. And it can seem intimidating going into a room with a politician, or going into a room, with somebody who works at the congressional level. But I often find that we have to remember that those people are in their positions because they do want to make their country or their city or even their town better. And so going in and being educated upon what it is that you want to tell them, being very straightforward, and also being willing to follow up with people and push people. And in every conversation I've had, it hasn't been difficult to get somebody to back things, especially something similar, something along the lines of the Seizure Safe School Act, right? If you tell the story, and oftentimes I doubt you're going to find people who don't want to be a part of the efforts.
Great, thank you. Yeah. So again, if anyone's interested in getting involved in advocacy, I think we put some information in the chat. We're always looking for great new advocates like Michelle. So Kate, last question to you before we open it up for Q&A. I think this has been a few times already, but very important. Can you share with everyone how to get a hold of the Epilepsy Foundation in case they need support related to mental health needs?
Yes, definitely. I want that to be one of the main takeaways people have from this, is just know that there's help out there always. You're never alone. And I think that message has been relayed by my fellow panelists, but I just think it's so critical. I wanted to say it one more time. At the Epilepsy Foundation, we have a 24/7 helpline. All of our information specialists have received suicide intervention training, and they can coordinate referrals to local providers or emergency services when needed. We can put a few other resources in the chat as well, but I just wanted to plug that we are available 24/7, both in English and Spanish, and that we are able to help get you to the right place, as well as others such as Nami, such as 988. So don't ever let the feeling like there's lack of help out there be the barrier for you. So please don't hesitate to reach out.
Great, thanks. So again, that's kind of we've gone through our discussion. We hope it's been informative for you, but we have some time left. So if anyone has any questions they want to put in the chat, I see one or two that were put in already, but answered already. So if anyone has any more questions, please don't hesitate. Just give it a moment. Great, I have a new one. So Michael, can you please talk about the status of the Psychology Interjurisdictional Compact and how it might be leveraged to expand access to mental health care for people with epilepsy?
Sure. So essentially, each state has their sort of own regulations. What this is trying to do is to get a compact between many states so that people can practice across state lines. As I talked about, there is a horrific shortage of mental health providers across the United States. And every state has a shortage. Some states are more severe than others, especially when you get into rural areas. There is a severe lack of mental health providers. So if you can have people being able to go across state lines, that would help. So what this is essentially agreement amongst numerous states that they would sort of recognize the various providers in each other state in their state. So trying to work on some of that maldistribution. The problem is essentially twofold. There's a lack of providers and there's also a maldistribution of providers. So this would at least be able to tackle that maldistribution.
Great, thank you. All right, any other? Okay, yep, got another one. With this compact bill, do you know if it covers marriage and family therapists? Because it definitely is crucial for people with epilepsy and their families to have access to marriage and family therapists.
You know what? I have to apologize. I do not know if they are included in that. But what I can tell you right now is there is a really big effort, and I believe it's going to be a successful effort in Congress right now to include marriage and family therapists under Medicare, billing for Medicare purposes. And that is going to help many folks who rely on that and really help expand the mental health workforce right now. I have to apologize. I do not know if they are part of that compact, though.
Great. We could look into that. Sorry, we don't go on the spot. If anyone else, I don't know if they're able to come off mute, if anyone knows, or put it in the chat. All right. Any final questions? I'm monitoring the Q&A box. All right, great. I just want to acknowledge, I just took a little peek at the participant list, which I hadn't done yet. And I noticed that some of our colleagues at the CDC are on, and the foundation has a great partnership with the CDC, and they do so much work related to access to care and data and everything. So just want to acknowledge their presence and thank them for all that they do in this space.
Yes, looks like we got a question too.
Oh, great. Thank you. Sorry, Kate, go ahead and I'll get the question after that.
Okay, sure. I just wanted to plug something that we were able to develop with some of our CDC funding was a behavioral health series for providers to take. But that being said, it's on our, Sarah, if you don't mind dropping in the chat, in our epilepsy learning portal. So if you haven't been Seizure First Aid trained, first step, do that on our epilepsy learning portal. But also, while providers are the target audience, there's lots of really helpful information. So maybe even just checking out like the epilepsy 101 about just mental health and epilepsy might, if you have interest, that would be, they were a really great webinar that we were able to develop. So would love for people to be able to check that out.
Great, thanks. And this next question that was put in the chat is a really good one. What is some advice if we are new to epilepsy? How can we make sure our caregivers aren't getting burned out? Any thoughts?
I can kind of plug in with this. I mean, obviously, I was an adult when I was diagnosed with epilepsy, but of course, my parents wanted to be involved, and something that I really did struggle with in the beginning is that I really blocked them out because I felt as though they truly could not understand what I was going through, which is true. They couldn't understand the gravity of these things. And it is something that I even still struggle with in the people that are around me that love me, is that I can be kind of distinct in not discussing what I'm truly feeling, or if I'm not feeling well because I feel as though I might be having a seizure soon, or anything like that. And I think what I've learned is that the people that are around you, that are your caregivers, they do it because they love you. And so a way that you can make their lives easier is just simply by communicating with them, even if that communication is just saying, I don't really think that you understand the gravity of things at this moment, and I just kind of want to take some time to myself to move through things. And also, something that I found that has been good for being able to go away from, I don't like to travel alone, say, right? And so if my caregiver couldn't go or something like that, I think I've always educated my friends on my epilepsy, and my friends, even when I was diagnosed, they made massive efforts to get educated, whether that was on just epilepsy itself or Seizure First Aid. And so understanding that the people that are around you, they want to help you, allowing yourself to give into that and to let people care for you, it makes it easier for both parties.
Great, thank you. All right, I think we have one or two more questions, or they keep coming, that's great. Next question, for the Seizure Safe School Act, is there any possibility of the addition of adding Seizure First Aid to a school curriculum similar to CPR training? So yeah, I'll talk about that for a moment. So Seizure Safe Schools is an initiative that the Epilepsy Foundation and many organizational partners are working on. It all started in Kentucky. There's an amazing teenager named Linsky who had come to our advocacy conference and learned how to be an advocate and really just kind of took off with it. And she herself, had experienced challenges in her school, as many people with epilepsy do. So she went back to her home state and really wanted to do something about it, to improve the lives of students with epilepsy. So Linsky got a bill passed in Kentucky very quickly. And the foundation, looked at that and just saw what an amazing idea it was. And from that bill, it developed what we call a model bill that we now urge every state to pass. So to your question, the model bill does have a requirement that school personnel are seizure first aid trained. The model bill also has a component where there's like an educational requirement for students as well. The student part hasn't been enacted in any state yet, but the school personnel part has been enacted now in 19 states across the country, just in the last few years. We've been able to get that many across the finish line, which is fantastic. A lot of very passionate families and advocates on the ground, as I call it, in the states, who are sharing their stories and advocating for the bill. So something we continue to work on until we get all 50 and DC done. And the next question, would you suggest the seizure first aid training for a corporate office, or would you have someone come to an office to train employees? I don't know, Kate, could you take that one?
Yes, we recommend seizure first aid training for everyone. So easy. And we are happy to work with you depending on the size. Now, we don't typically do in person. So just so people know, we do have seizure first aid available on demand. So once again, we put that learning portal in there. So please check that out. But for larger groups of individuals, we do sometimes, offer live trainings as well. And so the best, I will check on that. We can provide our training team's contact. Or if you're specifically interested, I can also put my email in the contacts in the chat, and I'd be happy to connect you. So multiple avenues.
Great. And then Michael, a question for you. Can you talk about resources to address substance use and abuse, in addition to addressing depression, anxiety? We often overlook this comorbidity.
Most definitely. And we know the two are so highly related that there's a high co-occurrence between the two. There's a lot of great organizations out there, but also in the substance use space, you see a lot of the same challenges that you see in the mental health space. There is a dire lack of providers in the substance use space, but there are resources out there for folks who are struggling. SAMHSA has a referral service. SAMHSA, is the Substance Abuse and Mental Health Services Administration. It's the government organization government agency that oversees mental health and substance use policy at the federal level, and they have a referral line which folks can always call. That's 1-800-662-HELP. And also the 988 number that I was talking about earlier. That's a suicide and substance use and mental health crisis hotline. So they also do deal with substance use issues also. Other great organizations out there like the National Center on Substance Use. So there are a lot of resources out there. And much like mental health issues, the first step is going out there and getting that help and taking that first step on the journey.
Great. All right, we have a few more minutes left, so I'll just pause in case there are any more questions people want to ask, but these have all been great. I've learned a few new things with the questions, so that's good. All right, I don't see any new ones coming in, but just know that the Epilepsy Foundation is always here for you. That our helpline has been put in the chat a few times, I think. So use that number if any questions pop to your mind. World Mental Health Day is around the corner, so we hope that everyone has been able to learn about the intersection of epilepsy and mental health. And we also hope that those of you who may need mental health support know how to get it now. And again, the Epilepsy Foundation and mental health organizations like Nami are all here for you all the time. So I'd just like to wrap up by thanking our panelists for sharing their experiences and expertise. It's been a great informational webinar, and it is being recorded for those who aren't able to join live. So thank you very much. I hope everyone has a great afternoon and evening. Take care.